when you're bathing or feeding the member, it's hard to do that from 6 feet away. So it's always important that when you're in the house that you can do everything you can to reduce your risk. And some of the things that I know you guys have been doing is practice good personal hygiene, washing your hands often with soap and water for at least 20 seconds, covering cough and sneezes with tissue or your sleeve, avoid touching your eyes, nose, and mouth. And really, the important thing is that any surface that you touch, you have to think that it may have coronavirus, and you need to disinfect it and then wash your hands. I think that the critical issue that I know that the home care workers are facing is the need for personal protective equipment, PPE. There is a critical shortage, but it's really important because you don't know if the client has had someone visit them that might have had COVID. Because the reason I say that is that 20% of the people who have COVID have no symptoms, but they still are infectious. And so that's why if you don't take the precautions, you can unintentionally expose yourself. So I always recommend when home care workers go into the home that you call the day before, find out if anyone has been in the house that has a temperature or has some shortness of breath. And if that's the case, then you need to talk to your agencies about what additional steps you can take. Can the visit be postponed? Can you talk to the doctor to find out whether or not the client needs to go in to get evaluated? Because it really is important that you protect yourselves, because you guys provide services that no one else can. You allow the client to be independent at home. But being independent at home requires that you're cleaning, you're feeding, you're preparing food, you're bathing them, you're walking with them. So it's close contact. It's impossible for you to stay 6 feet apart if you're going to service your clients. So it's really, really important that before you go out, that you have a conversation with your clients, find out how they're doing, and if you're concerned that there may be an issue, you should bring that attention to your home care agency, because no one wants you to go into an unsafe environment, because everyone who's on the street has potential to have COVID-19. Because I said 20% of people have no symptoms, walking around. But even if they have no symptoms, they're contagious, because the virus is in when they speak, and they can spray saliva if they cough or sneeze. That can infect you. So it's really important that you take charge to make sure that you're going to a safe environment. And that's why I would always recommend calling the client before, finding out if anything happens. Do they have shortness of breath? Do they have a fever? Are they fatigued? Is there something new that's going on? Is there a family member who is sick and who's there? Because that's also important, because when you go into the home, there are other people in the home other than the client. And so one of the things that I recommend for home care workers is that they wear a mask. And if they're going to go outside, the requirement is that you wear a mask. And the mask protects you and protects others. So taking care of someone at home that you don't know what their COVID status is, you need to take as many precautions as you can. So anytime that you're working close with them, you may, and this is where the issue becomes, is that you may want them to wear a mask, because that protects you from them, and your mask protects protects them from you. And the issue is that there is a shortage of PPE, but one of the things that is being pushed now because of the shortage of PPE is using cloth masks. And cloth masks reduce the amount of spraying from talking or coughing, but it's not 100%. So it really is important that you, before you go, you identify what are the risk factors there. You're talking to the client, you're finding out if anyone else there is sick, and then you can share that information with your agency to say, I'm concerned this member is now having fevers and chills and shortness of breath. I'm worried that they may have COVID, and the agency can then reach out to the physician and say, there is a concern about this client, and we need for you to be able to talk to the client and do an assessment of whether or not they need to go in to the emergency room or go in to the office and see the provider. But I think it's really, really important that you remember that you are as much at risk as anyone else walking into an environment that you're not sure what's going on. And that's why it's important for you to identify what are the risk factors when you're going in. And if you're concerned, really bring that to the attention of your agency. Because your agency wants to make sure that you remain safe and you remain free of disease. And they should have policies that, in addition to protecting the client, but also protecting the worker. That's all I have.
Okay, you are
available.
Okay. That's perfect. So I wanted to thank Dr. Van. We're going to take questions. I'm going to introduce Janie Lee, who is head of the outreach department for home care workers. And I would first like to tell you that we feel very strongly, the union, that all home care workers should wear masks on the train, in the client's home, and that to that extent, your agencies also want you to wear masks and have PPE, but they have not been available. And so the union purchased 100,000 masks and delivered them. Union officers like Keith Joseph, Vladimir Fortuny, Renee Ruiz, David Hohen, Kathy Guillaume, they delivered, and your organizing staff, I can't mention all of them, they actually delivered the masks, and we got donations from Health First of hand sanitizers and gloves, and we delivered those to your agency. We bought them. We got some donations to your agencies to make sure that while everybody is waiting for their shipments, that you have protection. And I hope that you are able to go to your agencies on the days that they're open to pick up the masks. I know that some of the agencies, like Partners in Care and Premier, have been mailing PPE to folks, and other agencies are not in that position. But the most important thing for you to know is that the agencies have the masks. We bought, they bought, and whatever we have to do to keep you safe, that's what we're going to do. So I would like to introduce right now Janie Lee, and she will talk about Benestream, One Medical, and then please be thinking of your questions, and we'll open up the floor for questions after Janie Lee. Thank you, Janie.
Thank you, Rona. Hi, good evening, everybody. So a couple of things. I want to tell you about One Medical. So One Medical is this company that we've partnered up with, that if your company, if your agency does not offer COVID testing and you think you might have symptoms and you want to be tested, you can contact One Medical and they will help you get tested. There's 3 locations in New York. I believe it's Bronx, Queens, and I want to say Brooklyn. You would have to download their app. It's called One Medical. on either your iPhone or your Android, and you would go ahead and click on, after you download the app, you would click on join, and after you join, you would go through all the registrations information, your name, your email address, and so forth. And when you come up to the payment information screen, there will be a link where you can press that says discount code. In the discount code, I'll repeat it a couple times. The discount code is 1199 CARE, CARE 30. So again, is 1199 CARE 30. That will give you a 30-day subscription. This is a subscription plan, and 30 days for free, so you can use them. And after you enter the 1199 CARE 30 code, you would continue on and click on the link that says COVID-19 symptoms. And from there, you would just check off what your symptoms are, whether it's sore throat, stuffy nose, it lists everything. And then at the end, if at the end of all the questions, somebody from one medical team, they will contact you and let you know where you can schedule your appointment for the test. Okay? If you don't want to use the app, you can also do it online. The address is members.onemedical.com. Again, it's members with an S .onemedical, ONEMEDICAL.com. And the same thing, it will be the log-on screen. You click on join, and you go through the registration. When you get to the discount code, you put in the 1199 CARE 30 for the discount code, and the charges should come up as 0. Then you answer all the questions under COVID-19 symptoms, and somebody will contact you on scheduling the test. If you don't have coverage with us, then the One Medical, the 1199 CARE 30 code will still work. However, they might charge you for the lab test itself. So, before you do that, maybe you would like to contact Venestream. Venestream is a service that we partnered up with that will help you apply for other coverage, whether it's through Medicare or Medicaid or something else that's available to you. And their number is 877-461-9328. Again, it's Benestream, like benefit, and a stream, Benestream, BENESTREAM. And their phone number is 877-461-9328. They can help you apply for other things other than health coverage as well. If you need food stamps, if you need home energy assistance, free phones, Benestream does all that for you. They look into what you qualify for any government-funded help, and they're there. Again, their number is 877-461-9328. And also, at this time, it is very hard to find a doctor's office that is open. We do have teledoc. Teledoc, you can call and have a virtual visit on the phone, by video, or by phone, just like we are now. And that is covered by $11.99. The number for teledoc is 1-800-TELEDOC, which is 1-800-835-2362. Again, 1-800-835-2362. We're going through very hard times right now, and sometimes if you just need somebody to talk to for mental health, they are there also, and everything is confidential. Okay?
Okay.
I'm ready for questions if you have questions.
Okay, Janie. So before we go to questions, I wanted to first of all thank you, and I wanted to tell the members that the outreach staff that many of the home care workers have spoken to for the last few years are still working. So if you would like to speak to the outreach worker, Lana, Irina in Russian, and the workers that speak Spanish and all of the other languages that our members speak, that you can call either the outreach folks that you have already been calling, or you can call your organizers or your vice presidents to get the information that Janie just explained. So at this point, Kathy, can we start asking the questions?
Yes, you can start taking questions. I will get the first caller. Hi, Melissa Wallace, you're live.
Yes, how you doing?
Hi, how are
Good.
you? The agency and your question, please.
Yes, I have questions. Like, I've been supplying myself, with my own gloves and my own mask for like the past 2 weeks, and because there's a shortage of gloves and masks, like I really didn't like. I don't like getting on the train, period. So I'm forced to take the train. I mean, I'm taking cabs every morning and every afternoon when I'm coming home, and that's costly. Like, is there anything that's $11.99 is accommodating us workers on, being that we don't want to take the train because we want to be safe going to work?
So I'll answer that. First of all, what agency do you work for?
I'm with Alliance for Health.
Okay. So Alliance for Health has PPE, and at this point you should not be having to buy your own PPE since they have PPE. So I would direct you to call your agency for that, so that saves you the money. On the train, we have a proposal into the federal government, and I hope that everyone knows that Trump is not interested in any of us or any working people in this country. And so we do have a proposal into FEMA so that it can help you with transportation costs, and we're going to fight to win that so that you are able to take private transportation. We haven't won it yet, so I don't want anybody to think we have, but that is one of the things we are fighting for.
Like into consideration, like a little a trolley bus or something that that gets us.
Okay.
That
Okay.
like money costly, like camp or cab, like something that
I understand. Okay.
Yeah.
You know what? We're working on different modes of transportation because we have hearing horror stories about being on the train, and we are working, but to get money from the federal government is, how difficult it is, but we are fighting to figure out some proposals from the federal government so that you could have an option other than the trains. And as soon as we get that option, you will be notified. So thank you very much for your question. Call Alliance for Health for the PPE. If you don't get it from them, call Hector Pena or call David Ho, and we will help you with it. And thank you for your question, and thank you for your work, and be safe.
Okay, we're taking the next caller. Patricia Fisher, you're live.
Yes.
Question and agency, please.
Yeah, I heard the girl say what I was going to say about the mask and the gloves and the bus and the train and people sitting beside you. If you sit, somebody come sit beside you. And some people is not wearing masks.
Where do you work?
I work all over. I work with personal touch.
Okay. So we can only do what we can for our members. We cannot convince the people on the trains, unfortunately, to wear masks or to be considerate to others, especially people like you who are home care workers. So we only have to try and protect ourselves and make sure that we have the masks. And I think Dr. Van can add to any safety things we should be doing for home care workers that are going on the train. Dr. Van?
Yeah, it's important, and I really want to emphasize this because a lot of people travel with the train. As I said, they can be asymptomatic, but they can have the virus on their hand, and they can touch the bar, and the virus can stay on the metal bar for up to 2 days. So that's why it's important. If you can wear gloves, to wear gloves. If you can't wear gloves, that when you get off the train, the first thing you need to do is to wash your hands, because we don't want you to take your hands and put it to your face, put it to your nose, because that's how the virus gets in and starts to get you sick. But I would recommend that if you're on the train, that if you have gloves and you have a mask, that you should wear the mask and wear the gloves. That will reduce your risk of coming in contact with someone who has COVID.
Thank you, Dr. Van. We're going to take the next caller.
Hi, good evening. My name is Monica Cedinho Velasquez.
What agency?
I'm from Best Care.
Your question?
You guys mentioned very good points that I've actually brought to the HR's attention and my agency's attention about the amount of masks they're giving out. Because when you walk in, they're only handing in two masks. How do you have 2 masks? You should be able to have at least, one for every day or whatever the case may be, but you shouldn't be having just 2. And how many times can a person come into the agency, to come in and they're just going to give you 2? So there is a shortage, and it is a problem. And my biggest question, which you guys answered, was the testing, to get the testing done. So now, is that also available to the home care's family members? The testing, the COVID testing?
No.
Under that one care that you guys have, or what First Med, or whatever it's called?
Janie, can you answer that?
Yeah, I'm trying to remember. I don't want to give you the wrong answer.
No, it's just for the members. It's just for the members.
It's just for the members.
Yeah.
Okay.
Yes,
So
yes.
even if they were covered under the $11.99 insurance, it would only be the actual home care member that would be covered for the test.
Yes. I mean, the union is fighting for more testing for healthcare workers in general and for home care workers. And as soon as that we get more testing sites, and the governor has been talking about the lack of testing sites, and we will be notifying you where you can go. But the emphasis right now has been on trying to get our healthcare workers tested. So, but we'll continue to try and fight for testing, because that's what's going to, stop this pandemic.
Right. And the important thing about testing, there are 2 types of tests. There's a test to see if you have the virus, and there's a test to see if you have antibodies against the virus. So if you get the test for looking for the virus and you're positive, that means you're infected with COVID-19. If you have the antibody test and it's positive for the antibodies, that means that at one point you were infected with the virus, but now your body has given you possibly immunity, so you can't get it again.
Thank you,
It
Dr.
really will
Van.
depend on what test you get.
Thank you, Dr. Van. We'll take the next caller. Hi, you're live. Name and agency, please, and question. Hello? Hi,
Hello?
Tanya Simpson, you're live. Agency
Yes,
and
hello.
question, please.
Yes, I'm from Partners in Care. And my question is,
I understand that there's a shortage of PPE supplies all across the board. But my question is, the home health aides, are we going to get like some type of bonus? Because I'm coming out my pocket with the spray with Lysol because I have a client that constantly coughs, doesn't cover her mouth, just coughing all over the place. And I'm not trying to catch nothing to bring home to my family. So I'll come with my own disinfect sprays and stuff like that. But I'm wondering, are we going to get like a hazardous pay for during this time? So we are fighting in Washington D.C. to get the home care workers recognized to get hazard pay to cover your expenses, so that that you can continue working. So the answer is we are fighting for it. I'm not going to say yes because we haven't won it yet, but we are not going to stop trying to get it for you because we think you deserve it.
Okay, we're moving on to the next caller.
Hello? Yeah.
Hi, Ms. Gloria, you're live.
Yes.
Agent,
Yes. How are you?
question, please? Good.
Yes, that's the question. I was asking, people who are sick already doing this job, do they get compensated for staying home after the return, before they return back, or they just stay home and don't get paid while they're home?
Loretta, you want to answer that?
Sure.
Loretta?
Yes. Can you hear me?
Yes, we hear you, Laura. Go ahead.
Yes. Okay. So if you are a worker who gets sick, you are entitled to sick pay under the state law that was passed recently to provide COVID-19 paid sick leave. That in order to obtain that leave, you should get a note from your doctor that says that you're eligible for the leave, either because you tested positive or you haven't been tested but you're symptomatic, or that you've had some type of contact with someone who has tested positive and need to isolate or quarantine. And then you will be able to get paid by your employer for the days you need to take off. And that is, it can be up to, if you're then get better, it would be up to 7 days, and then you would return to work. But you'd be paid for the hours that you regularly work. Whatever, if you work 3 days a week, you'll get paid for those 3 days. But you do need to get a letter from your provider that says that you're eligible for that leave and that you need to take the time off. And that leave does not count against your paid time off that you have under the collective bargaining agreement.